Did you know? Bronchiectasis is a long-term condition where the airways of the lungs become widened, leading to a buildup of excess mucus that can make the lungs more vulnerable to infection. The most common symptoms of bronchiectasis include a persistent cough that usually brings up the phlegm or the sputum and shortness of breath. Though it is most often linked to cystic fibrosis, many other conditions can trigger a bronchiectasis, such as autoimmune disease, immunodeficiency disorders, such as HIV or diabetes, chronic obstructive pulmonary disease or COPD, and alpha-1 antitrypsin deficiency, which cause COPD in some people. Symptoms of bronchiectasis can take months or years to develop and gradually become worse. The two primary symptoms are a daily cough and daily production of mucus or sputum. Other symptoms typically include the coughing out of yellowish or greenish mucus daily, shortness of breath, fatigue, feeling run down or tired, fever and or chills, wheezing or whistling sound while you breathe, coughing out of blood or mucus mixed with blood, a condition called hemoptysis, chest pain, clubbing, or the thickening of the skin under the fingernails and the toenails. Did you know bronchiectasis is an underdiagnosed condition, with many patients being incorrectly diagnosed with other lung diseases? Early diagnosis is important to prevent further lung damage. Assessments that may help diagnose bronchiectasis are: number 1, chest X-ray or CT scan are the most common ways to diagnose bronchiectasis. Both tests create a detailed images of your lungs, heart, or the airways. Lung function can determine how well your lungs are working. A sputum culture can tell your doctor if the bacteria is in your lungs. A sweat test may be ordered to determine if you have cystic fibrosis. Blood tests can also tell if you have low levels of infection fighting blood cells. Did you know antibiotics are the most common treatment for bronchiectasis? Oral antibiotics are suggested for most cases, but harder to treat infection may require intravenous or IV antibiotics. The goal of bronchiectasis treatment is to treat any underlying conditions, prevent lung infections, remove excess mucus, and prevent flare-ups, also called exacerbations. This is done with the combinations of medications, hydration, and chest physical therapy. Oxygen therapy may be recommended to raise low blood oxygen levels. Surgery may be recommended in extreme situations where the bronchiectasis is isolated to a section of a lung or there is an excessive bleeding. And now you know!